Thank you for joining us for the Humboldt County Department of Health and Human Services COVID-19 Q&A. My name's Mariah Miracle. I'm a Public Education Officer for DHHS. I'm here with Dr. Teresa Frankovich, the Humboldt County Health Officer. So Dr. Frankovich, let's just start with a few basics. Coronaviruses have been around for a long time. Can you tell us why people are so concerned about this virus in particular?
Sure, well, and you're absolutely right. We certainly know coronaviruses have been around forever. And we know that coronaviruses, actually certain strains cause the common cold. So we see it not uncommonly in people across the United States and globally. What's different is when you have a new strain emerge that we haven't seen before, and people around the globe have no natural immunity to that strain. And that's what raises concern.
Okay. How does this virus spread?
Well, that's a really good question. Right now, we know that previous coronaviruses like SARS and MERS primarily spread through droplet. So people coughing, sneezing, those droplets landing, or people inhaling those droplets. And that was the most effective mode of transmission. The other means of transmission are airborne, and we see that with measles, where you can simply be in the same room with someone and easily pick up the infection. It's not clear whether we're seeing any airborne transmission of this virus yet. And then the other mode is through contact surfaces. So people coughing, sneezing, droplets landing on surfaces, and then people touching them to their eyes, nose, mouth. And that may be a mode, although it's not likely as effective as the droplet spread. So droplet spread is probably our prime mode with this virus right now.
And given that chance of spread, or those methods of spread, how concerned should Humboldt County residents be about this virus?
Well, I think what the global picture is showing us is that this virus is going to circulate within the communities. We're not unique, and we're seeing it in a growing list of countries, over 60 now across the globe. So we will see it here. The question is when, and I think the ultimate question is when it does arrive, will we have a large number of cases quickly, or will they sort of putter through the community? That makes a big difference in the impact on our healthcare system. And then the other question is, how severe is the virus when it causes infections in people here?
And that's my next question. What are the consequences of the virus? Is there any treatment for COVID-19?
Well, there's no treatment right now, although a vaccine is in development, and there are antiviral medications that are being tried for treating individuals with severe infection to see if they're effective. But I think the real critical question is, how serious an infection will this cause in people? And as we've mentioned before, there are really three factors. One is, what is the mortality rate? The second is, how easily is it transmitted? And the third is whether there are means to treat it. And we just spoke about the last issue. The first one, in terms of severity, really we're trying to assess that as we go. I'm sure people have seen mortality rates listed all over the board from different sources online. But the real key question is, if you have if you have 10 people that you know have the infection and one person dies, you think the mortality rate is 10%. If there were actually 1,000 people who had the infection that you didn't know about because their symptoms were mild and one person dies, that's a mortality rate of 0.1%. Big difference in terms of impact. And so as we get more accurate case counts about how many people are really getting sick in a mild way with this virus, we'll have a much better sense of how serious it is in what percent of the population.
So given that, how long do you think it may be before we start to see the virus spread more widely in Humboldt County and elsewhere in the United States?
It's, again, unfortunately really not clear. We're certainly seeing the beginning of community transmission in various areas in the country. And I think that when we watch those communities move forward, see how quickly it spreads there, it'll give us some sense of what it may look like in our community when it occurs. But I would say certainly it'll be over the coming weeks to months that we'll be dealing with COVID virus.
What should we do differently when that happens? For example, how do we avoid infection, and how do we keep our families safe?
Well, again, the staple that we keep talking about are basically influenza kind of prevention measures. So the really good hand washing, particularly before you eat or drink, when you come home at the end of the day, and then frequently through the day if you can, or use of hand sanitizers, because again, we're just trying to avoid that spread because of contact on surfaces. The other thing is making sure people are covering their coughs so they're not spraying droplets, covering their sneezes, and staying home when they're ill. Finally, people in their home should be cleaning frequently. It's an important measure because those commonly used surfaces like your phones, your remotes, your doorknobs, your handles on cupboards, the refrigerator, all of those things are places that everybody touches in the home, and cleaning those frequently can help reduce spread within the home. And certainly if someone in the home is ill, trying to really enhance that cleaning and keeping that person a little bit more separate from the crowd can help.
Okay. Is this the kind of virus that you only get once, or is there a possibility of reinfection?
Well, there's been a lot of debate about that online with some cases of people who seem to have been cleared perhaps and then had symptoms again. But it's looking like that may actually just represent some testing issues. That as our test is getting better and more sensitive, we're able to pick up virus that we may not have picked up at the tail end of infections before.
Okay. You've mentioned social distancing as a strategy to reduce spread of the virus. Some large gatherings have been postponed or canceled in other parts of the world. What strategies will Humboldt County use to prevent spread at large gatherings or at public events?
Well, I think the first strategy is just to, as you sort of alluded to, is to reduce spread in those events rather than canceling them right out of the gate. So having things like hand sanitizers at events, having postings about people not attending if they're ill, encouraging them to stay home for that, and having a separate place for people to be if they become ill during the event until they can get home. So I think there are ways we can maintain our life during this, initially at least, without having to cancel. But ultimately, if we're seeing widespread transmission and it's happening quickly, we may want to cancel those events just to slow spread in the community.
How will public health be communicating with Humboldt County residents once we do start to see community spread? What sort of information will be shared?
Well, just as we've been doing, we'll just be trying to put out information as soon as we have it in hand and making sure that people are aware. And if we are contemplating things like social distancing measures in terms of events or even working with schools about temporary closures, we'll be keeping the public informed about that, and we'll be working with our community partners to make those decisions.
Okay. Parents with young children are understandably concerned about the virus. Are there any particular strategies for breastfeeding moms, or are children and babies more susceptible to this virus? Is there any specific guidance for families?
Sure. There's not a lot yet because we're really still looking at the information coming out of China, where they've had the bulk of cases. However, what we do know so far is it really appears that children in particular seem to weather this infection pretty well and have had some of the mildest disease. There really is not a whole lot of information about this illness in pregnant women and infants. However, there are a couple of small studies out of China that suggest that there may not be transmission through breast milk or maternal to fetal. And so that would be great news. But we don't, again, yet have a really great sense about impact on pregnancy. We know that the MERS and SARS infections that were passing through communities years ago did have some potential impact on pregnancies. So we'll be watching this virus carefully.
What about vaccines? So we've heard that everything from a few months to a few years to get a vaccine for the virus. Do you know the status of that?
Well, I think it's likely to be months and possibly a year or slightly more. I think that when we saw H1N1, we were able to develop a flu vaccine really quickly, but that was because we had flu vaccine previously, and we just had to tweak it a little bit to represent the new strain. There is no existing coronavirus vaccine prior to all of this, and so the development phase and the testing for safety and efficacy just takes some time. So certainly months. It's not on the immediate horizon, and it is very likely that we will be dealing with places with lots of community transmission before there is a vaccine available. So those public health strategies of hand washing, covering your cough that have been our mainstay will remain important, as well as social distancing down the road.
Thank you very much, Dr. Frankovich, for your time.
Welcome.
If you would like more information, you can call Public Health at 707-445-6200 or go to humboldtgov.org/Humboldt Health Alert to sign up to receive alerts about COVID-19 via email or text message.